Welcome to the course. In this course, we're going to show you how to read your body and other bodies. So when you look across the street, you'll be able to pick up what's going on inside by the outside. You're going to look at their eyes, their lips, their nails, and really have a deep understanding of what is going on inside. Now, I want to just make a quick disclaimer that we're not trying to make a mini medical doctor out of you or make claims to cure or diagnose any medical conditions. This is purely educational. It's entertainment, okay? So that's my disclaimer. Now, let's get right into the course. The first and most important thing that you need to understand is this one thing right here. The symptom does not equal the problem, okay? Now, in medicine and healthcare, what they've done, they made the symptom the problem. They collapse these two. Now, if you do that, you're going to make the problem last a lot longer and persist. And I think the reason why they've done it is purely financial, because the whole system is rigged to have you go to all these specialists and put you on medications and have you keep going. So what they did is they take this symptom and make it sound very complex and very scientific, like lumbalgia, that's low back pain, arthritis, pain in the joint. There's even a diagnosis called dystatokinesis. That means inability to perform rapid rhythmic movements. Okay, so in reality, these are plain descriptions of what the body is experiencing at the effect. So these are effects. Okay, the effect is not the cause. Now, this is why I don't like donating to a lot of the different March for the Cures and the research, because it all goes to the same drug companies that are not looking for a cure. They're looking for some drug to manage the problem. That's called managed care. I mean, if you take Merck's manual, the authority on diagnosis or pathology, you're going to find that almost every single diagnosis is unknown. The cause of it is unknown. And so that's why one of the diagnoses would be called idiopathic. That means unknown cause. So things don't just come from no reason. Don't buy into you're getting older, it's always genetic, or it's just the way things are. You're going to have to accept the fact that that's just how things are. So the symptom is not the problem. The second thing that's missing is this little problem here with a lack of evaluation. When you evaluate, you dig deeper. You find out an underlying root cause. That's what science is about. It's about finding the truth of something. So we want to evaluate, we want to investigate. So what we want to do is we want to ask questions. What kind of questions? Well, if the body has some dry skin, if it has a red dot, if it's cracked corners of the teeth, if there's bloodshot eyes, if your hair is falling out, if you have high blood pressure, high glucose, all these things, we want to ask a question, why? What is the body trying to tell us? And we want to pull a string. Now, you want to get as much data as you can. In this little course that I put together, I gave you a lot of understanding of what certain things mean, nutritionally and whatnot. But we want to find out the biggest question that I always ask over and over and over again, of when it started. Okay, so we have when. When did it start? All right? Because we want to narrow down. There's always something that occurs right before the problem started. So we go when, and then what happened just before. That's going to give you huge, what happened just before. That's going to give you huge clues on what's really the true cause of the problem, just before. Now, if you just ask these couple questions, this obvious answer will just pop right up. And it's like, oh, why didn't I think about that? When you find the true cause of something, it should be pretty obvious. It's not going to be some mysterious thing. I'll give you an example. I had a patient, she had angina. That's a fancy term for chest pain. And she went to the doctor. She went to the hospital. Emergency care, they did all these tests, and they found nothing after $40,000 worth of testing. She comes in, and the first thing I asked her, I said, When did it start? She said, last Tuesday. I said, what happened just before that? She goes, that's right, I went out to dinner. I said, okay, what else? Oh, I ate a banana split. Oh, thank you. Do you ever eat that? She goes, no, never. So she ate this banana split. That's going to plug up her gallbladder, which is right next to the ducts to the liver, and that's going to back up the liver and put pressure on the heart. So all I did is do a little tiny acupressure on the bile duct, okay, which is right here, and chest pain went away, never came back. So it's very, very, very sane and very simple, these simple questions here. So you have a diagnosis called complex regional pain syndrome. What is that? That means that when you have surgery and you still have pain after the surgery, they call that complex regional pain syndrome. And I have so many people coming in for that. They're doing fine until they had the surgery and now they're in pain. Now, I'm not against medicine or doctors or any of that. I'm against the system it's set up. What I want you to do is ask questions. Find out why. Don't be satisfied with, well, I'm the doctor, you're the patient. Find out, that's what we're trying to do. So we have the symptom, and we have the problem, we have the effect. Now, when you ask this question, what happened just before the symptom started, there will always be, well, not always, usually one of four things, all right? Number one, it could be something they ate that they shouldn't have eaten, okay? That's probably a big one right there. Or it's something they should have eaten but they didn't eat. People that never eat anything green, except pistachio ice cream, lime green jello. That was me going to college. So it's eating or not eating, all right? So that's going to give you a lot of clues. And by the way, if you look to the right of the screen, there's a little button if you press it, you're going to get into a survey about my course called the Health Course Certification. It's called the Health Coach Certification. And I get into what you should be eating. I teach health coaches on what they should be training their clients on, what to eat, and this entire method right here, and a lot more in depth. But in this little presentation, I'm just going to give you some of the basics, but there's more to know. So number two can be related to stress. Stress, I mean, if you ask a person what happened just before they had this problem, a stress event, let's just take weight. Delivering birth, you think that's stressful? Big time. That's stressful on the mother, it's stressful on the baby. Carrying a baby for 9 months, that could have threw off the body and made you gain weight. I'll give you another example. I had a guy just come in today. He got hugely fat right when he stopped smoking. That was the change. Now that was a stress event. Now you're going, wait a second. No, it wasn't. You're taking smoke away from him. But actually, the nicotine relaxes the adrenal glands, and it's actually a stress reliever. I know it sounds weird. All the smoke doesn't help. But when they stop smoking, they get real nervous, and the stress goes up. So the stopping of the smoking shocked the adrenals, and he got really fat. Happens all the time. So stress, but it could be you can be in a situation where you're being stressed out at work, or you've been through a stress event, or a loss. Oh my goodness! You really almost every single client that came in here with MS, for example, multiple sclerosis, they had a stress event or a loss right before they got it. So autoimmune diseases get set up with losses because it's a major stress in the body. So we have stress, and then we have environmental factors. Environment. And that could be an exposure to pesticides, herbicides, fungicides. That can be exposure to a toxic relationship with your spouse or a relative or something like that. I think everyone usually has one relative who is very toxic. But the environmental stress can be quite big, or being exposed to radiation. If you're just close to Chernobyl, that could be an environmental stress. And then number 4 is going to be a lack of sleep. Okay, so we got this sleep. It's usually not sleeping too much. It's basically getting a lack of sleep. If you push your body on 3 or 4 or 5 hours of sleep, you are going to break down faster. You're going to have health problems. You're going to be tired. It's a lot of stress on the heart. And then if you add exercise on top of that, you really push the person over the edge. But a lot of times I'll have people come in with all of these problems right here. You know what's really bizarre is there's very little attention put on these 4 things in healthcare. I mean, could you imagine if they focused on these? I mean, the relationship between what you eat and how it affects your health is huge. The only way you're going to create a healthy body is by the nutrients in the food that you eat, but there's no attention put on those foods or nutrients. I've even developed some software to analyze the nutrition in your diet, and rarely do we have anyone that is even close to getting enough. So pretty much all my clients, when they come in, they're not eating the right things, they're eating too much of the wrong things, their body is just one big stress ball, they're in environmental toxicity, and they're not sleeping, okay? Other than that, they're perfectly healthy. So I want to make this very, very simple to you because it really is. Once we find out and ask these questions, then we can get the remedy, the true cause. So we want to define the cause, and a cause would be you can't go any deeper. Like, I had a lady, she said, I was depressed. I said, describe that to me. She said, oh, I feel just really tired. I'm like, oh, okay. Maybe it's fatigue. Maybe it's not depression. She goes, yeah, I'm kind of tired in my head. I said, well, what made you think you were depressed? She goes, well, that's what I was diagnosed. I said, you know what? You're just tired. She goes, wow, I feel a little better right now. So the symptom is not the problem. We want to use the symptom as a string or a clue to understand the real problem, cause, effect. We want to evaluate. We want to find out what's the body trying to do. We want to understand when it started, what happened just before it. We want to look at the 4 factors right here. And then when we find that main thing, boom, we can plug it in as a remedy and the person can start getting better, okay? So in the next video, I'm going to show you a little technique on how to get rid of any pain anywhere in your body. All right, so we're going to talk about that. And also, I'd like to invite you to actually be a health coach. And what the health coach training is, it's an 8-week course, which is all online. It's like an hour or 2 a week. It's not that hard. You'll be doing homework. It's very interesting. But if you like the ability to help people and you like to figure things out, you can take my 25 years of blood, sweat, and tears and summarize it in an 8-week course and learn the basics and actually help either do it full-time, part-time, or just as a hobby, okay? So I invite you to take the survey to my left and actually become a health coach, all right? So I hope you enjoyed this. I'll see you in the next video. Good luck.